I'm Kathy Weaver, Executive Director of Guideposts of Strength.
I'm Dr. Bernard Chinnasamy. I'm the President and Medical Director of Guideposts of Strength.
Welcome to GPS News, a regular look at how the headlines affect cancer care and vice versa. Today we're going to do something a little bit different. Generally we talk about an item that is making headlines, such as a study or news about cancer. Today I want to talk to you about something a little bit different. It's Prostate Cancer Awareness Month, September, and we at Guideposts of Strength have decided to do something a little bit different than the typical awareness of the disease, early diagnosis and early symptoms. We're going to kind of be a little bold and forward-thinking and look at some of the other issues that affect prostate cancer patients, as well as patients with other urological cancers that would include bladder, kidney, testicular cancer. Our program for this month is going to be called Straight Talk from the Man Cave. And that may sound a little bit funny, but we wanted to keep it lighthearted because we're going to deal with some tough issues. Cancer is diagnosed so much earlier now that I think we're learning that it affects the whole life of an individual. And for men with the urological cancers in particular, it affects their sexuality, their sensuality, their self-esteem, their fertility issues too. Some touchy subjects, obviously, but I think they're issues that need to be dealt with.
Absolutely. And this is a great time to bring up all this because as cancer care gets more sophisticated, cancer is now becoming a chronic disease. What do I mean by that? I mean people are now living for such a long time with cancer now that you now start thinking about the other things, not just survival. And prostate cancer is a great example of this because people, even with a diagnosis of advanced prostate cancer, can live a long time. So like you said, it affects them in ways that we never really wanted to touch on before, and men really don't like talking about this. But not only does it affect the men, but it affects their spouses too.
True.
So I think these are things that we need to bring up and be upfront about it so people know what to expect. And when they're choosing the modalities of therapy, they choose it not just based on survival, but also the side effects. So we need to be able to create a much broader canvas for them to be able to understand what they're expecting. Because their decision not only affects them, but affects their spouses as well. So I think as we move forward, this needs to be front and center to be able to help patients with this.
I totally agree. What we're going to do is, with this program, Straight Talk from the Man Cave, is we're going to have a urologist, Dr. Craig Hall, a medical oncologist, Dr. V.C. Harish, and men who have dealt with this disease and are currently dealing with all of these diseases meet at 7 p.m. on Tuesday, September the 18th at the Resource Center at the Hayworth Cancer Center at High Point Regional Health System. And it's going to be men only, so women, there will be a spouse sitting service available. We want men to be comfortable and to be able to talk about these sensitive topics in a dignified way and in a sensitive way while not just making it clinical. We want to deal with the real issues people face. We spoke, both of us together, at a Rotary Club meeting a few months ago, and I was really impressed because a man stepped forward and talked to us then, and he said that he had just been through treatment for prostate cancer, and he said, I want to go out and talk to a man about the things he worries about when he's diagnosed with this disease. And there are a number of things that do worry you.
Absolutely. And it's also when you're getting treated, you're so concerned with survival. But after you start surviving, you then start realizing, hey, what about all these things that I really didn't think about? Now that I've got my life to live, how am I going to live it to the fullest? How do I feel like a complete person? And how do I want to enjoy everything else regular people do? So part of it is how do you re-enter your world you used to live in.
Right.
And I think we need to be able to create that environment for men to talk. Women have been way more proactive than men. And it's time that men caught up with women. Mm-hmm. And I think we need to get started someplace. And I think this is the first safe place to talk because now you see women are even able to talk about it with men present.
Right.
So I think men need to come out of the dark ages, the caves.
Yes.
And so this is a good place for us to start, for them to understand that there's no reason for them to have to be ashamed of this or worried about this because there's help. And we want the experts to be able to help them.
And it's okay to want more than to just be alive.
That is correct. I mean, that is what we call, good quality of life. It's very important.
Mm-hmm.
So, and that gives you something to look forward to and do.
There are issues with prostate cancer that I think a lot of us are aware of, certainly as far as sexuality are concerned, but then we also look at issues when we deal with other urological cancers, bladder, kidney, testicular, that really bridge a lot of different topics, including fertility. And I think that we want people to come into this meeting with their questions and realize we've got two experts who will really be able to help them deal with a lot of tough questions and probably surprisingly good answers about what options people have.
That's correct. Till you ask the question, you don't know what answer you're going to get. And I think what we all need to do is be able to be forthright in our questions. And nobody has the answers to everything, but what answers we don't know, we need to be able to find out.
Exactly.
And we need to be able to give this to people so that they actually have solutions to their problems.
We're launching this program in September because it is Prostate Cancer Awareness Month. But I want our viewers to understand that this is something we plan on revisiting several times a year, because your diagnosis of prostate cancer or of testicular cancer may not coincide with the month of the year that it's being recognized nationally. Again, I want to remind you that Straight Talk from the Man Cave will be held at 7 p.m. Tuesday, September 18th in the Resource Center of the Hayworth Cancer Center at High Point Regional Health System. And all you have to do to register for the program is to go to www.cancergps.org and register for one of our programs, or either call us. We'd love to have you, and we promise this will be a really enlightening event.
Well, thank you for your attention, and we look forward to seeing you there.